Hello and welcome to the Mental Health Hub. I'm your host, Dr. Pamela. I want to welcome you again to this channel where we explore the issues of health and more so as pertains to our mental health and our psychological well-being. This YouTube channel is an interactive opportunity that I present every Tuesday for you and me to be able to look at the issues that concerns our well-being. It is important, especially at this time, because mental health has become or increasingly becoming a challenge even to wellness. It's becoming a challenge to families. It is becoming a challenge to workplaces as well as nations. Mental health is increasing the burden of disease in our country, especially now, because it turns out that research indicates that the incidences that we have today of people manifesting mental health disorders are on the increase. And therefore it becomes important for us to be able to discuss this matter, to be able to help our people and ourselves to be able to live a better life. And having said that, I want to say today that I want us to look at one component of management or an intervention that we use in mental health to support a person that is unwell, or even to help the people that they live with to understand. I am referring to an intervention called counseling, or to some people they will call it psychotherapy. So this talk therapy that is very, very important can be done in various settings. It can be informal or even formal. Informal in the sense of whereby it is not in like a treatment facility, like a hospital, so that also we can be able to offer counseling even at the family level. We can be able to offer counseling in groups. We can be able to offer counseling to individuals. It is important to note also counseling can be for a family. It can be done at the workplace. It can be done even in a church facility. So talk therapy is very, very important. Talk therapy or counseling can be done as a way of creating awareness, so that we are raising awareness on the importance of mental health. So it can be done as a preventive strategy. It can also be done as a treatment strategy, whereby already somebody has been identified that they have a mental health issue, or a family has a mental health client, and therefore they require to be supported with counseling to know how to manage themselves as well as manage the identified client or the identified person in the family. In counseling, we help the person to be able to understand themselves, to be able to understand their feelings, their thoughts, and their behavior, so that then they can live a more fulfilling life when they understand themselves and they are self-aware and they are able to manage their life well. Counseling helps restore healthy relationships for the person on their own, or even with the other people that they relate with. Counseling also can be offered in a rehabilitation center. And in a rehabilitation center, counseling can be done to the individual, or it is done to the individual, where this individual who is in the rehab is offered personal therapy. Or it can be done in groups so that a group therapy is also taking place. A family comes in to be supported through this strategy of counseling or the talk therapy so that they can be able to understand the illness of their significant other, so that they can be able to be the support mechanism that this person requires for them to live a better life. Counseling also can be done post-rehabilitation, whereby after one has been rehabilitated or has been in a hospital facility and they are now out there, they can be supported with counseling so that they do not relapse, what we would call relapse prevention as a strategy. So it is important to know counseling can be done even post-rehabilitation. And counseling, as we have said, it is not done by somebody who has not been trained. It is a professional helping relationship. A professional helping relationship. This will demystify the fact that, you will hear some people say, I offered counseling. I met her and I counseled her on the road. I met her and I actually counseled her. No. If you have not been trained to offer counseling, then you could be able to advise, but you didn't offer counseling. Because counseling is a helping relationship where a professional is able to work with the person with an issue in life and to help them deal with the issue that they are faced with. Why do I say it is not everybody who will offer counseling? Because for a person offering counseling, there are theories that they apply. Science has been able to help us understand what are the theoretical perspectives that we can be able to use to help a person resolve the issues of life. So there are theories that we use, there are strategies, there are skills. It's like looking at a mechanic. It's not everybody who is a mechanic, if you allow me to use that word. A mechanic comes with the toolbox, and the toolbox has the right tools for whatever part of the maybe a vehicle that this person is trying to fix. So the professional also using the toolbox, if you'll allow me to use that word, what they have learned during the training, what they have gained as they offer support, so that they can know what tools to use when and with the person who requires help. That's why counseling is not done just by anybody. And remember, also this helping professional or this counselor, if you allow me to use that, has been trained maybe in one area of the profession. What do I mean? There are counselors who are trained to deal with matters addiction. So they are addiction professionals. There are counselors who have been trained to deal with HIV. They will deal with HIV. There are counselors who are career counselors, so that they can be able to support a person to deal with the career. There are those who have been trained in areas spirituality. There are those who have been trained to deal maybe with the elderly. There is a counselor who has been trained to deal with children. So there are various fields of psychology that this person may have to get skills in, so that then they are proficient in one or so other areas of psychology, so that they can be able to offer support. So counseling as a strategy, very, very important, but we need to be able to appreciate the fact that it is not everybody who can offer counseling. People may be able to advise, but they may not be able to offer counseling. But basic counseling skills are also important. Why do I bring this up? Because the need in the community is big. The need for people to be supported is growing. The need for an individual to be able to understand themselves is, on the increase, and it is on the rise. So even basic counseling skills, I wish every adult could be able to get some basic counseling skills. Why would it be important? Because it will help you as an individual to be able to negotiate about the issues of your life. It will be able to help you self-manage, so that then you don't have issues that are overwhelming. To reach a point, they will develop to stress and probably grow to become mental disorders. You can be able to manage self. When you have a person or more people having basic counseling skills, we can be able to identify the needs in the society, the needs in the family, so that we don't wish away things. So that as many as, a critical mass of people with basic counseling skills will really better the situation in the community. Because we will be able to take this service to the last mile. We don't have to go very far to get somebody to identify a need, either in the family or in a group of people, or even in a school. That's where we have peer counselors, where some youth are identified. Maybe it's in a training school or even an educational facility, where some youth are identified or volunteer and are willing to be trained as peer counselors, so that they can be able to offer some basic counseling to other peers within the training institution. This helps us to identify the needs early before illness progresses to a level that you really need even medication. So counseling, being a very important strategy in life, will be able to will be useful to help live a better life, be able to support oneself and support other people within our area of or sphere of influence. So this talk therapy will be a tool that we can use to resolve the problems that present on a daily basis. The basic counseling skills in our workplace will help us to identify needs early. That's why ideally it would be important if this could be a strategy that can be used even at the family level, where we have an opportunity to have one or so persons within the family that can be trained on basic counseling skills. It will help us to balance our life better. This one person can be able to identify issues even at the family level and call us to order, where we will be able to learn from this member of the family that this person, this one of us, is not that they are pretending. They are going through a loss because maybe they failed an exam. It is a loss that we need to be able to support this person to deal with, so that we can be able to look even at an elderly person in the family, our parents, our grandparents, and understand what is going on with them, so that we can support them. We can be able to pick a developmental condition early enough and refer for support. Remember, in counseling, you cannot be the one to do everything. When you reach your limit, you are supposed to refer to another person for support, to another profession for support. If you identify this person as an addiction issue and you are not trained in addiction, refer to an addiction counselor. When you identify this person could be requiring a physician to identify if to run some tests to see if this person has a physical illness, you refer to a physician. We don't handle it all because we don't know it all. Besides, you need to be able to specialize in an area or so that you perfect your heart and become that tool or instrument of service that is required in the society. With counseling, we are able to help people know themselves, be self-aware, so that then they can be able to reach their potential. So counseling being a talk therapy, it is a therapy that is guided by some skills, by knowledge, for it to be effective. How I wish that at our levels of education system, at the levels in workplaces, more could be taught or more could be involved in gaining this skill to empower the society that we live in. Because as a trained professional, you are not judgmental. You don't tell somebody to live your life. You support this person without being invasive in their life, without judging them, without trying to make them like yourself. Because counseling is not about replicating you. It is about being able to support this person to be themselves, to be the best of themselves. That is what counseling is about. And if we understand this, we'll remove this stigma of saying, why are you going for counseling? Are you mad? Can't you deal with your issues? Counseling is not for mad people. Allow me to use that word, though, that is loosely in the society, because that is what you'll hear as people refer to somebody who has a mental illness. It is not a good one to use, and it is not good to be used on anyone, but that is what at times the professionals feel when you in the community, one is saying, I cannot go for counseling. I don't need counseling. Counseling is for people who have lost their mind. It is not for people who have lost their mind. You do not have to be sick for you to seek counseling. Even in a normal situation, when you have to go through change, when you are preparing even for a promotion, or you have been promoted, when you are preparing for marriage, when you are preparing to bring in a new family member, when you are faced with a change in the community. Look at a time like when we have a lot going on, even in politics. Counseling is very, very important. So we need to be able to appreciate the place of counseling in the society, so that then we can build a society that is, or a people that are functional, a people that are able to deal with the issues of life and face daily stresses in a way that they don't break down. They are able to cope with the challenges of life. So I hope to see you appreciating counseling. I hope to see many people getting to seek this support. And better still, I hope to see more, or to have and more people getting interested in this field of study, so that we have the critical mass of people in the society that can be able to support others, so that we can have a population that is healthy. See you next time, and I hope that this has handed to the knowledge about counseling as an intervention that is very important to help us live a better life. Remember to like, share, and subscribe. See you in the Mental Health Hub next episode.